waiting for the slide to be loaded, but I've just listened to the presentations here before, and a lot of them actually building into what I'll be talking about here. How we can go from understanding community vulnerability and the nutritional status as an indicator of how well they do, to build on that for better crisis preparedness and responsive capacity. It's really about how do we respond to crises when they happen. Not just, early warning is good and being, monitoring that it's coming is nice, but when it is there, you need to be ready to act and to have an impact to change things. This is going to be very important. And I'll be presenting a couple of ideas here in terms of how that could be done. First, we have to agree that it should not be acceptable that every shock leads to large-scale suffering and disruption of community life. We're going to have shocks. But when I say unacceptable is, of course, the global community, that's fine. But it has to be to the country's leadership and to the local leaders that they just don't want that. If you look at the Green Revolution, there was a time in India where it became unacceptable that they have things like that. And we also just listened to the example that Casina presented here. In Bangladesh, the Grameen Bank and others, people decided that they want to change things. And once you start doing that, then you're starting to be able to do something. But it has to reach that level that is just not acceptable. And second, once you do that, now you focus on boosting preparedness, being able to act when crisis comes. Not to know when a crisis comes and it's going to be heard, and so you need to know what to do, okay? And to have the response capacity in normal times before you hit the crisis. If you get those two, you'll make progress. It may be slow, but you'll get things going. To do that, you need to invest in understanding the patterns and the nature of vulnerability in very detailed fashions in your country and your communities at the local level. You need to take deliberate action targeting those drivers of vulnerability. That's where the data and analysis comes in. And use a comprehensive indicator to track short-term impact and sustain action. If you're just acting because you're nervous and there's a crisis, you're not measuring your progress, you have no way of doing that, the same crisis comes again and you're not learning the lessons you need to learn. So with that, look at the crisis. In the case of Africa recently, we talked about the Ukraine crisis. We looked at different countries. No matter what the indicator you use here, the set of bars are just different indicators of poverty. It's going up because of the Ukraine crisis, anything that was behind the Ukraine crisis, whether it's Kenya, Senegal, Tanzania, and Malawi. We're seeing Tanzania changing a little bit, but you're being rocked and things are just changing. Does it have to be? You certainly will have to deal with the shocks when they come, but do they have to be that scale? Then you look at what was happening even before the crisis. And that's what's important. It's not the crisis that's rocking us. It's just that some way, in a chronic way, we are not dealing with this thing. So that when a crisis comes, it emerges. The issue of right we're talking about, the issue of committing to the common good, the right measurements are just to be able to know that we have these vulnerabilities, to understand their characteristics and the patterns and deal with it. So when COVID came and when Ukraine came, things were already deteriorating in Africa. So what is perhaps a little bit of an unfortunate thing is that globally we're not talking about what was behind this change in trends. Africa had remarkable 20 years since 2000, but certainly things are going south. Why? It was not COVID, it was Ukraine. But it has a lot to do with our being able to turn economic growth, improvement into greater resilience because of lack of understanding of these patterns of vulnerabilities. So here I have a couple of examples we can use. An example where communities deal with disruptions effectively in a regular way is the example of snow emergencies in many countries. It's not a very Sahelian example, I should say that, right? But we need to know the communities that are most likely to be hurt when we have crises. In most municipalities, they will know where to put the snow truck before the snowfall. Do we know where to position our operational apparatus before the crisis hits, when the crisis does, so that we can act? To do that, we have an example here of Malawi And this we did during COVID. We use a composite index of vulnerability by looking at different dimensions that can make a community vulnerable. The advantage of that, whether you're talking about stunting, food expenditure per capita, distance to health centers, access to health services, prevalence of chronic diseases, you're also talking about drivers of vulnerability. In normal times, you can act on those. But by doing this analytics, at least you know where the next crisis is going to hurt, because that's where you have the least absorptive capacity, and you can work on that. It doesn't take a lot to do it, but it takes that commitment that is unacceptable, that the next crisis is going to lead to wide-ranging disruption. Then you start focusing, where are the most exposed and what can I do? And what are the factors that are driving this vulnerability? In the case of Malawi, you know that those areas in red are definitely your most vulnerable areas. Then you start addressing those different dimensions in those areas before the next crisis come, right? And here we're using relative ranking. We're not comparing Malawi to Tanzania or Malawi to Kenya. We're comparing Malawians to Malawians, so you can do your ranking in your country and to know where the most exposed are. So what the snowplow principle does is that we use community vulnerability index, and you can construct it in any way that you want, but it allows you to locate the priority vulnerable and nutrient deficient areas. Before you have a crisis, you know where to put your snowplow. You identify the priority investment areas to reduce vulnerability in normal times, just like you prepare to make sure when the snow comes, it doesn't hurt. And then finally, you plan and target crisis response measures in those very same areas because you're prepared. But then while you're acting, you want to know that you're making change, you're making progress. You don't want to wait until the next crisis to know. And here, another example we use is the thermometer. When you walk into a clinic, the first thing they do is to take a thermometer. Is it a viral infection, bacterial? Did you fall from a car? Did you get hurt by whatever indigestions? They look at your thermometer, your temperature, because then the temperature gives them an idea of the status of your body. And when you're in an emergency room, they look at your temperature. Is the fever going down? Is it going down? They're tracking something to know that they're having an impact. And that is important to have as we deal with emergencies and shocks in the communities. Here, what we're proposing, there was something was supposed to be that is missing. No? I have a slide with, okay, it's not there, but it should be. Maybe it's hidden. Let me go back to that. So I have a map here that shows the nutrient deficiency across 11 micronutrients at the community level. Just like the fever temperature tells you what the status is, micronutrient deficiency or nutritional status is a comprehensive indicator, just like the fever is. If you're poor, it shows. If you live in a marginal area, it shows. If you're, of course, in an area where you have a lot of chronic diseases, it shows. If you're in an area where you don't have access to health services, it shows. If you're in an area that's excluded from all infrastructure, it shows. It's a simple indicator that allows you to have something that you can look at to track and to target your short-term interventions. The vulnerability factors just allow you to have the map and understand the patterns of drivers. You cannot change stunting to know whether you're acting well within the next few months during a crisis. You cannot change access to health services. You cannot change access to chronic diseases, prevalence of chronic diseases while you're acting. But if you have the tools to collect consumption data every month, every week, whatever, you can track the impact of the changes of the interventions while the crisis is unfolding. So that's what it does here. So it tells you where the areas are that are highly vulnerable, and in those areas, those are very much suffering from a very big gap of nutrient adequacy. You focus on improving the nutrient adequacy during crisis, meaning the consumption of goods. That is, we're talking about food security here. But to do that, you have to have parameters that allow you now to be able to know whether your action is having an impact or not. So for that, we derive income elasticities of individual micronutrients and price elasticities of individual micronutrients in urban and rural areas. What that allows you to do is, even in normal time, policies that governments are running, programs that they are running, changes around the economy, you can all bring them down to what does it mean for the livelihoods of those food deficient households in those very vulnerable communities. So you're focusing very squarely on that as you invest in boosting their resilience, as you invest in being prepared for the next crisis. You avoid through your regular policies, your regular strategies, and whatever is happening in your country, you can anticipate what it will mean for your communities. But also what it does is that whatever the crisis is it a conflict, is it a drought, is it flood, is it the global markets? If you have the parameters in place and you have that understanding of your community levels, you can already know what's going to hurt and what to do when it gets there. If you want to answer to the crisis with distributing foods, you know which foods, in which areas, just because of what you know what the deficiency is. If you want to use income transfers, you have an idea of what it's going to mean in terms of shoring up consumption levels. If you want to use subsidies, you will have an idea of how to structure your subsidy. It helps you not just avoid bad policies during normal times, but also helps you to have the right interventions that are targeted so that you can have an impact on the local level. So this is just rural areas and urban areas. So what does the example of the film thermometer, if we want to use it, allow us to do in predicting and dealing with and monitoring impact while we acting on emergencies? You can use an indicator like the nutrient adequacy, which is comprehensive, that can reflect a bunch of dimensions of what's happening with the local community. And that you also can really affect and change while you're acting. And here, nutrition adequacy is not measured through blood samples, but just by converting the food that is consumed using a food composition table. It's not complicated. You don't need a lot of complicated stuff to do it. A survey, light touch, allow you to do it. But when you do that, you can monitor the change before the crisis, during the crisis, and while you're intervening, and that allows you to know how impactful you are, what the lessons are, and how you can learn from it as you go. But also you addressing the issue where it hurts in terms of people's nutritional status. You can evaluate policies before you have a crisis in terms of the impact on nutrition adequacy, especially nowadays. You're hearing a lot of African countries talking about our country share, introducing almost a police to police traders and shops and fixed prices again, right? So you can tell them what it's going to mean for the country and for the poorest community once you start doing that. People start hoarding things and it wouldn't work, right? Before you have even the next crisis. But when you do it and then you stifle trade, then you have the next crisis who's going to get the goods moving, right? So you can have the discussion now in terms of what it means for the poor and the food vulnerable people. So you can assess the effects of shocks on nutrient deficiency as a way of targeting and responding, but also you can invest in priorities to boost nutrient intake in normal times again, just before you get to the crisis. So this preparedness is important, knowing where the vulnerable people are, the drivers of the vulnerability, having a workable indicator to track your interventions during crisis. So the advantage of this approach that's being proposed here is that it has very limited data requirements, most from secondary sources. It's easy to administer, simple relative ranking for vulnerability, and conversion of food consumption for the nutrient content. It has a very low cost of implementation, light touch consumption surveys when you need it from time to time, where you do that. You don't need any special software. A simple spreadsheet in Excel would do, except for the estimation of the elasticities, which you don't do every time when you have a crisis. And it is an intuitive and easily accessible content that can be shared with communities, with leaders on the ground, with technical people, with civil society organizations. It's nothing complicated and complex. It translates into their language, and you can use that for action and to rally collective efforts once you have this crisis. So bottom line, know where the vulnerable people are, use something that is simple to track them, know the drivers, act on them during normal times, and be prepared to know where to act when the next crisis happens. And all of that under that commitment to make sure that these crises should not ever lead to large-scale disruption of livelihoods, unacceptable for the national leaders and for the local leaders. I think the rest would fall in place. So thank you very much for your time.